everybody, Dr. Vince Gutierrez here, physical therapist. You can find me at movementthinker.org. This video is about laying around. Well, not really laying around. Obviously, we're going to do some sort of movement here. This exercise is called prone on elbows. Okay, just lying on your belly, up on your elbows like this. This is a good way to improve thoracic extension. Again, that mid-back ability to flatten out. A lot of people are stuck in this position and they can't allow the back to sag through. Okay? If you're having trouble with this, you can always move your hands forward, or you can just start off with a flat position. These positions, they shouldn't hurt. They should feel stretchy, just like if you were to bend your finger back or stretch your hamstring. There should be nothing left over when you're done doing this. Like when you finish a stretch, you feel refreshed. When you finish doing these positions, you should still feel refreshed. Okay? So you hang out in this position a couple minutes. Make sure there's no pain. If there's pain, you should see a physical therapist or somebody who's trained in order to treat pain. None of these exercises are meant to treat anything. They're just help to make you move better. That's it. Again, move better, live better. But this is a good segue into the next exercise. Next exercise is called a press-up. From here, you have your hands underneath your shoulders. You pull your chin back and up towards the ceiling. Allow yourself to elevate. Some patients can't do this. So let's talk about some of the errors that we see with this motion. And so this should be a nice fluid motion. You should feel your spine segments move, or your back. You should feel it. You should feel your back moving. You'll feel pressure in your back, low back area traditionally, maybe a little bit into the top of the butt. But there shouldn't be any pain, and definitely there shouldn't be any lingering pain. Okay? But one of the major errors that I see with this, and I tend to see this in more guys than girls, is people do push-ups. Okay? So instead of this fluid motion here through the spine, we tend to see the hips lock up, and they go up into this position. Their thighs come off the table, their belly comes off the table, their pelvis comes off the table. Again, we're looking to increase mobility. On this spectrum of mobility, just to give you guys an idea, I tend to explain to patients, you have one end of the spectrum in which you have something more like a wet noodle, right? You drop it and it just kind of falls, completely folds. On the other side of mobility, you have a 100-year-old oak tree. It's not moving, right? It's not good to be either ends of those spectrums, right? You need to be able to move with some control over the movement. If you're too stiff, you won't have enough mobility in order to do things that you should be able to do every day, like swing a golf club, right? Reach into your back seat. But if you don't have strength, you're also going to have trouble doing anything that requires movement, because you're not going to be stable enough, right? Define stable enough, who cares? But you're going to be like a wet noodle, right? And so we want to make sure that you're somewhere in between strong and mobile, and not very strong and very stiff, and not very strong and too mobile. Okay? So again, when you're doing this, your hands go underneath your shoulders. Lead with your chin, shoulders, low back. You'll feel that arch. Hold for a couple seconds, and then lower back down. This is also called a cobra pose in yoga. Okay? You want to try to minimize your hip from tightening up, so you don't want to squeeze your butt muscles together when you're doing this, because when you do that, the whole body moves up as a segment. Okay? The other thing that's important is to try to lock out the elbows. Okay? So if you can't get to this position, then what I would advise patients to do is move their hands forward and work on getting to that position. Now, these are two different exercises, okay, based off of where the hands are at. You can see in my back that if I put my hands forward and I come down, a lot of the movement happens in the middle portion of the back. But if I bring my hands completely underneath me, a lot of the movement happens in the lower portion of the back. And so where you put your hands can dictate what moves. Big picture, you should have full pain-free range of motion in all directions. That's how you remain functional. Move well, live well. Thanks for watching.